Right, so people should be coming in now. I'm going to stop my video.
Is somebody going to cue me?
We close the video now?
Sorry?
Please keep your video open while I introduce everyone.
Yeah.
Okay.
Oh, I'll turn my back on. Right, we have a few people arriving. Let's not hold it up any longer. I think we can probably start.
All right.
Maybe a few people more dribbling in, but I think we're safe.
Great. Well, good morning, good afternoon, and good evening to everyone joining us here for the Center for Excellence in Development, Impact, and Learning webinar on crossing the social barrier, participatory theater as a means to overcome gender-based violence. My name is Annette Brown. I'm principal economist at FHI 360, and I'm your chair today. I want to first thank CEDL for hosting this and acknowledge that CEDL is funded by UK Aid. Also, before we jump into this, I want to let folks know that there is an anonymous survey that will be available at the end of the webinar. We'd love to have you fill it out so that CEDL can continue to provide us with these wonderful learning opportunities. So today's session is going to begin with a presentation of an academic paper, and then we have 3 panelists who will provide some discussion, and then we'll do a little Q&A among us, and we'll definitely have time at the end for me to relay some of the questions from you, the audience, so that the panelists and the presenter can answer some of those questions as well. So we all have our videos on now so that I can introduce everyone. Dr. Jyotsna Jalan is going to be presenting the paper for us this morning. She's an applied econometrician with a doctorate in economics, and she conducts research on poverty, education, health, and estimating the economic impacts of development programs. Her areas of interest are in the methodological aspects of modern evaluation techniques of economic interventions, as well as its applications. And this paper is going to give us an excellent example of her application of those skills. Our first panelist is Dr. Sanjoy Ganguly. He has a Doctor of Theater Studies, and he is the author and artistic director of Jana, Sanskriti, the Center for the Theater of the Oppressed. So he's in charge of the intervention that we'll be learning about in this research, which is very interesting. He'll be followed by Dr. Floriza Gennari. She's a behavioral scientist and a gender researcher with a doctorate in public health, and she has many years of experience managing and evaluating global health projects in Latin America, the Caribbean, and Sub-Saharan Africa. She's currently a behavioral sciences lecturer at George Washington University and a researcher at the UNICEF Office of Research, UNICEF. Also, interestingly, her doctoral research examined the use of a bystander-based intervention to reduce sexual harassment in public transportation in Mexico City. So maybe we'll hear some about that in her comments. And then our final panelist will be Dr. Elizabeth Dartnell. She's the executive director of the Sexual Violence Research Initiative, the world's largest global network on research and violence against women and children in low and middle income countries. She's a health specialist with decades of research and policy making experience on health systems, mental health, violence against women, and violence against children. She's also worked for the South African Department of Health, and she's worked in Australia on public health and mental health policy, but spent the last over 15 years working at SVRI and establishing it as an independent NGO. So with those introductions, I'm going to turn it first. We're going to see a clip of the Theater of the Oppressed so we can all have an appreciation of this intervention. And then Dr. Jalan will proceed with her presentation.
Jyotsna, are you going to be launching the videos? Sorry.
Hi, Jyotsna. We can see your screen, but we're not seeing the video.
Oh,
We just, we see your folders.
okay. Let me just go back. Can you see it now?
We see that you clicked on a file, but it's not opening.
Oh,
Is it opening on your screen?
yeah. Did you see the first video?
No, all we've seen is your screen.
Oh, okay. I don't know.
You might need to share the specific program rather than just your screen.
Okay,
Go
let me
back
just try doing it again. Susie, I've sent it again to you. See if you can show the video.
Sorry about this, folks.
Can you see that now?
No, I've opened up choosing a daughter-in-law. Is that the right one? Jyotsna?
Yeah.
Is choosing a daughter-in-law the correct one? Of the
Yes,
two that you-
choosing the second one,
The-
domestic violence.
Right. Okay, one moment. Right.
Sorry about this.
No, so, yeah, sorry, people. Right, can you see the video? I'm afraid the sound isn't working.
Yes. Square in the middle. There, I think we can all see it now.
Did you want to
And it's
show the
the-
other? Sorry.
Yes, the next one, the daughter-in-law one.
বাবা ওরা ভোগ করে নিয়ে যাবে ওরা দেখবে না ভালো করে না আমার এসব মোটে পছন্দ হচ্ছে না চলো বাবা এটা নিও একটু বউ করবে সুন্দরী কিনা তোমার একটু থেকে যাবে কিছু না 7-5টা মিনিট দেখে তো তুমি ওরকম করছো কেন না আমরা এইভাবে বিয়ে করে আমার মতে শোনো যদি আমাকেও তো তোর বাবা এরকম ভাবে দেখে নিয়েছে দেখে নিয়ে যাবে তো তারা ঘরে বউ করে নিয়ে যাবে দেখে নিয়ে যাবে না শোন শোন বউ বোঝার চেষ্টা কর না এইসব চুল দেখা এই পা হাত নিয়ে হাত দেখা এ তো একটা মেয়ে দেখে আমি দেখে নিয়ে যাবে না ভালো কি খারাপ পাঁচজনে যেমন দেখে আমরা সেভাবে দেখছি আমি এভাবে বিয়ে করব তাহলে বিয়ে করলে আমার মান সম্মান তো চলে যাবে কি চাইছেন পাত্রে তো আসবে দেখবে মেয়ে কতটা পড়াশোনা করেছে সেটা জিজ্ঞাসা করবে
Okay. Okay, we are done with the videos. Should I start, Annette?
Yes, please do. I didn't want to interrupt. Please go right ahead.
Okay, thank you. Let me start by thanking Marcella and Susie of Settle for organizing this wonderful panel to discuss an issue that is important globally and across all societies. My talk is based on a background paper, Participatory Theatre Empowers Women, Evidence from India, which is co-authored with Carla Hoff and Shartik Chantra. And this is research which I have been working on for the last 4 or 5 years. And this is the first major paper which has emanated from that research. The videos that you've just seen are a good starting point to my talk, where I will describe how such participatory theatre can reduce domestic violence that is strongly entrenched in patriarchal societies. Now, a little bit of background. Violence against women is common across the world, be it in low-income countries or highly developed economies. This is despite the fact that it has very high costs and imposes great harms to women and children. Economic growth nor legal prohibitions have been successful in quelling such violence. In India, the Protection Against Domestic Violence Act was implemented in 2006. But according to the preliminary data from the latest round of the Demographic Health Survey for India, less than 5% of women who have faced domestic violence volunteered to go to an institutional outlet like the police station to register a complaint against their assailants. Similarly, edutainment that communicates information in a narrative form with fictional characters have also had a limited impact. The question is, why violence against women is so entrenched in societies that common engines of development have failed to stop it. The next two quotes which I show, it actually tries to answer this to an extent. Basically, in the first quote, what it shows is a man can only prove his masculinity by hitting or beating his wife. In the second quote, what shows is while the husband is supportive of his wife and treats her as an equal, but he does that only within the four walls of his home. Outside his home, he cannot do the same because the social norms does not allow him to do the same. So in this paper, what we show is that a novel cultural intervention has the potential to lead people to question patriarchal gender relations, change the social meaning of domestic violence, and reduce its incidence. Participatory theatre gives communities the means of analyzing oppression in fictional but familiar situations, interrogating the oppressors to better understand the thinking that underlies their behavior, rehearsing resistance, and negotiating standards. We evaluate whether such participatory theatre actually led to lowering of abuse and increasing empowerment among women exposed to them. We evaluate the impact of Jana Sanskriti, which is one of the largest organizations in the world that performs such participatory theatre. Before I go on to the context in which I do the evaluation and the results from the paper, let me spend a moment to talk about the evaluation problem at hand. Recognize that the evaluation problem is not a randomized controlled trial. So in some senses, there could be some endogeneity in the choice of the villages. The JS could have chosen the villages who are more prone to accepting the message portrayed to them through their plays. Alternatively, JS could have chosen the villages where domestic violence was very high. In both cases, if we treat the choice of villages as exogenous, we would be overestimating the impact. So in our analysis, we actually assume that the choice of villages were endogenous, and we use econometric methods to control for the endogeneity so that we can establish causality. Now let me tell you a little bit about the context in which this evaluation takes place. The intervention that we are evaluating is in the state of West Bengal, which is an eastern state of India bordering Bangladesh. Of the 19 odd districts in West Bengal, the district that we look at is the district of South 24 Parganas. This is the southernmost district in West Bengal. And this is the district where Jana Sanskriti has been operating for at least 2 decades or more. The dark blue blocks within the district are the treatment blocks, and the dirty green blocks are the ones which are the control blocks. Now, our targeted population was married women between the age 18 to 14 years of age and their husbands. Approximately, we surveyed 3,500 couples in our survey. Now, let's look at the first results. Before I talk a little bit about the results, since a lot of the questions were sensitive, we actually followed the protocol as written in the, as specified in the Demographic and Health Surveys of India. The questions on abuse were only asked of the female respondents. They were not asked of the male respondents. And the survey was as is normal in these cases, was done in isolation with no one around, and where the women could speak quite frankly. So our analysis, we looked at 3 types of spousal abuse. Our analysis finds that village exposure to Jana Sanskriti reduced all forms of abuse. Next, we look at 3 different indicators that proxy women's empowerment. Marital control is defined as freedom to meet friends and family without taking the husband's permission, and whether the husband trusts his wife with money. Our results suggest that exposure to Jana Sanskriti reduced marital control of wives by their husband. Yet, there's another feeling over here that, that women who are free from marital control is still very low at 9%. Earlier, I showed that impact of JS was to reduce incidence of domestic violence, which suggests that exposure led people to question the ideology of patriarchy. One way to assess this is to examine whether wives in treatment villages were allowed a greater role in making decisions about their lives and their households. This is a valid measure of the impact on the ideology of patriarchy, because JS plays are about pivotal life events, not about day-to-day household decision making. Thus, if in this daily decision-making, a wife has greater voice, it is not because of priming a role model effect. Instead, it is because her role is seen differently. We find that village exposure to JS reduce the voicelessness of women in household decision-making. Finally, the overarching goal of JS is to change patriarchal norms, or to change patriarchal village norms. To do this, we compare treatment villages with and without a JS performance on patriarchy and alcohol issues in the 4 years preceding the survey. There was no difference in impacts between treatment villages with and without recent performances on these themes. Another way of testing whether JS challenged village norms or not would be a finding that village exposure to JS changed behavior and attitudes of couples in a treatment village who never watched a JS performance. We find that watching a JS play was not a necessary condition for village norms to change. New ideas and new gender roles expressed in JS performances spread through village networks and changed village norms. I conclude that with the saying that what participatory theatre does is equips villagers with new stories, impulses, and critical thinking to question the ideology of patriarchy. It creates a space to negotiate patriarchal norms, unlike edutainment. I thank you all for listening to me, and I leave you all with some pictures from the field survey. Thank you.
Well, thank you so much, Dr. Jalan. That was extremely complete and quick presentation. I appreciate you saving so much time for the comments and the questions. We'll move to you now, Dr. Ganguly.
You need to unmute, Sanjoy.
Should I put up my video? No. So Jyotsna has presented the concrete impact of our theatre and introduced Jalan Sanskriti as one of the largest theatre of the oppressed movement in the world, which is true. And also we are the first exponent of theatre of the oppressed in India. I would actually present some theoretical frame of my theatre, which so I will take a couple of minutes or less than a couple of a minute to just tell you why did I come to this theatre. I was in a regimented party where I experienced the culture of monologue, because we were all asked to listen, to watch, and to follow blindly, and to carry out the orders which comes from the top. So this was perfectly a culture of monologue. And also I experienced a kind of religiosity inside my party, because there were photographs of the party gods in the party office. So those hanged photographs were gods, so you cannot criticize them. So if you are a Stalinist, you cannot criticize Stalin. So this was, they made Stalin a god. So this religiosity also something that I did not like, and I experienced lack of space for debate discussion. So I left the party finally. When I left the party, I thought of organizing agricultural workers in the village, and I went to the village, and then I came across the traditional art form. The traditional, my perception on tradition was very different. Later on, I realized that I looked at my tradition through a lens which did not represent the actual picture of the tradition. So I felt like we threw the baby with the bathwater. So when I went to the tradition, I found in the traditional art, they want to make people very argumentative. The characters are very complex. You cannot go with any character, full of complexities, controversies. And also it is therefore very introspective, because after watching those traditional theater, you can look at yourself. If you feel inspired to look at yourself. So these are the elements that I discovered in my traditional art. So it was not just a moral teaching, and it's not just a monologue by the superpower in the society. It was basically an attempt to make people social critique also. I'm not a traditionalist, I'm not glorifying my tradition, but in tradition, I also, with some bad things which we should reject, there are some very important progressive and scientific things that I noticed, and I started learning traditional art. While learning traditional art, I found a theater person in me, and that's how I came to the theater. My theater initially was influenced by propaganda theater. And you see, I was in a party, we were propagandists of the ideologies. And naturally, I internalized this culture of propaganda. So I started the propaganda theater. Initially, it was going well, and there was a construction that I knew better than these villagers. So that was also the construction. So that is how I used to look at the people. But while working in the village, day by day, I was living in the village, and every day I was getting to know the intellectual ability of the people. And slowly, I have a lot of stories but 10 minutes will not be sufficient for that. But I realized, not theoretically, but I realized that every individual is essentially intellectual. They are intellectual, but they are not aware of it. So I thought by not recognizing their intellectual faculty, I was violating the human rights. So therefore, I was looking for a form which can extend an intellectual space, which can extend a democracy to the people, to the spectators, and we can actually discuss and debate. So that at that point of time, Boal came in my life, Augusto Boal, my teacher, my sir, my guru. So he came to my life and he said, I will extend all sorts of cooperation to you and to see that you can reach your objective. So he was throughout my friend, 18 years we have worked together before he passed away. So this is how we started the interactive, I mean the forum theater which Jyotsna has presented, where spectator becomes actor. They come on stage, replace the protagonist and show how do they like to address the problem. So initially it was just a problem-solving session, and slowly we realized that this is basically restricting the intellectual participation of the people, because somehow our approach was being imposed on the people. So we started this practice not as a problem-solving session, but as a session to develop critical thinking among the people. So it's not about solving the problem. So go deeper and deeper and deeper, like Jyotsna had shown the scene where the husband is beating his wife. So this is a scene through which people, actor and spectators, should get to know how patriarchy is acting as an ideology within us, how patriarchy is even internalized within the women because of their upbringing. So they understand this construction and they inspire to break that construction. So breaking this construction is what we call critical thinking, and this understanding of patriarchy, what I call an intellectual journey, means journey from result to reason, from effect to cause, from experience to theory. So in this intellectual journey, we actually script intellectual power. So our theater is basically scripting intellectual power through participation. So this scripting intellectual breaks the passivity, and naturally in real life, spectators and actors, they act in their real life. They try to change their reality. So that is, they become what I call spect activists. I have explained this in my last book published by Routledge London. There I have explained how we create spect activists. So they come as spectator, they become spect actor, and then scripting intellectual power, they act, ultimately they become spect activists. So this is where we need to discuss with the people. We should create an intellectual space, and in that intellectual space, this is my main point of practice. My practice gives the most important to it. There is no technique which can help you to understand to construct the relationship between actor and spectator. It is not about technique, it is about attitude. So if you think that every individual is essentially intellectual, it should not be a theoretical intellectual decision. It should come from your heart. So head and heart should be connected, because when the head and heart is connected, you develop the right attitude. So if you have the right attitude towards people, then you feel some kind of oneness, a non-duality between actor and spectator. They become non-dual. In such non-dual relationship, the democracy is born. And we learn in democracy. We can learn only in democracy. So this theater not only create an intellectual space with democracy, a tune of democracy is there. So we actually discuss and go through the critical, discover new questions, address those questions, and go to the critical thinking. Also at the same time, it is very introspective, in the sense sometimes if you have seen the portrayal of domestic violence in Jyotsna's video, you can see sometimes the men, they think, oh, it's me on the stage. It's me on the stage. I do this to my wife every day. So this is how I act. So the moment he realizes this, he is actually looking at himself as a spectator of his own actor. So when we see spectator as an own actor, when we become our own spectator, we actually discover the oppressive personality we have. An agricultural worker at home is oppressed, even though he is oppressed outside, but in the home, at home, he becomes oppressor. So that oppressor construction he can see. And then the human being he has inside fights with the oppressor. So theater, that is how the positive conflict exists, and we say theater can humanize the human being. So the moment you are the spectator of your own actor, so what is theater? Theater is the combination of actor and spectator. So when you are the spectator of your own actor, you are theater. So we make everyone theater, and then we make theater. When you make theater, what do you call scripting play instead of playing the script? We script the play by using theater and theater games exercise through as social metaphor. So by playing those games and exercise, they get to see examine their reality, internal, external reality. They bring stories out of that, and then the stories of oppression is portrayed in the play. This is what you call scripting play instead of playing the script. So basically, what we want is that people do not know that they are intellectual, they are capable of thinking. So there is an inferiority. We just want to remove this inferiority within the people and help them to manifest the intellectual faculty, what they have already within. So our practice is we take the same theater. Just tell me if I am going long, just stop me.
Yeah, you're over time now, Sanjoy. So if you could give us a last sentence to wrap up.
Okay, so we actually take the same play to the same audience 3 times at least, because we know that after performing once, the debate continues. People cannot resolve. So that intellectual incompleteness, something I couldn't do. So this feeling we want, people should live with that kind of feeling. So in the second time, after a month when we go, then the debate again takes off after the reflection. So this is how we follow at least 3 times. We go to the people and try to initiate the debate, which is continuing. So this debate and discussion is ultimately the key to construct intellectual power. And constructing intellectual power, you can create the need for democracy. And if you can create the need for democracy, it becomes actually the basic need of the people. Democracy is a basic need.
All right.
Thank you.
Thank you so much for giving us that background to the theater of the oppressed, Sanjoy. We'll move now to Floriza.
Hello, thank you so much, Jyotsna and Sanjoy, for that really rich description of Jana Sanskriti. I'm truly fascinated by the approach that you've taken, and really enjoyed reading the background paper and learning more about how it's been implemented. So let me just share my screen here so that I can, there we go. Let me see if that works. Okay, can everyone see that?
Yeah.
Okay, great. So I decided to take a slightly different path, and I decided to use a behavioral theory interpretation to examine the Jana Sanskriti intervention. And I'll just elaborate a little further on that. So I'm going to do 2 things here. The first is I'm going to apply behavioral theory to this intervention, or to this theater, to see if we can shed any light on how to replicate this methodology moving forward and adapt it in other contexts, to other topics, and potentially to video. I know that was something that was mentioned in the paper. And then I'm going to briefly discuss the intersection of violence against women and violence against children, specifically violent discipline, because that was also something that was mentioned in the paper as a potential area to explore further using Jana Sanskriti. And then, of course, I'll mention some questions and issues to consider moving forward. So changing social norms and behaviors. This is often a black box process, and the underlying mechanisms behind social normative change can be tricky to identify. And transforming harmful gender norms in a culturally sensitive and ethical manner can also be difficult. And as a lot of us working in any kind of behavior change know, fade-out effects are common. In other words, behavioral interventions can often require booster sessions to prevent recidivism or relapse. The Jana Sanskriti interventions seem to have achieved all three, but why and how? Which learnings can be applied to other contexts? Can behavioral theory contribute to the Jana Sanskriti methodology? So in my research, as Annette mentioned, I did look at a bystander intervention approach to see if it could be used to increase witnesses' willingness to intervene in incidents of sexual harassment in public transportation. And I focused a lot on the psychological antecedents of willingness to intervene and actual intervening behaviors to understand the underlying mechanism behind motivation and the behavioral changes I saw. And I classified these into psychological antecedents that were facilitators and barriers. So the facilitators that I looked at that I think were also just really stood out to me in the Jana Sanskriti intervention was self-efficacy. So self-efficacy is basically confidence in one's ability to carry out a behavior. So it's a strong predictor of behavior change, and practicing resistance likely increased the spectator's self-confidence and skills to reject oppressive behavior. Similarly, outcome expectations, or the belief that one's behavior can make a positive difference in an environment, was established probably by serving as a spectator or actor. Vicarious or observational learning, I think, is one of the most important constructs that I observed in reading this paper, and that is the ability to learn a behavior by watching a model perform it and then feel motivated to perform it. And also of note, self-efficacy increases when individuals observe models that they perceive to be similar to them. So in this case, individuals are observing those from their same village, from their same community, acting out a behavior. So their motivation to copy that behavior is probably much higher than if it were someone from outside of their context. So some barriers that I saw that applied to the bystander intervention approach that I worked on in my dissertation research, and that I also see similar taking place in the Jana Sanskriti, is victim blaming. So we know that victim blaming is negatively associated with helping behaviors. And I thought it was just really brilliant that the Jana Sanskriti intervention addressed this by specifically targeting empathy. And of course, descriptive and injunctive norms, or the perceived pervasiveness or acceptability of a given behavior. This can affect whether an action is considered a transgression. And it can, they can also act as a facilitator or a barrier, depending on whether they are harmful norms or whether they are positive social norms. And so it seems like the Jana Sanskriti has really done a good job in taking harmful social norms and making them, turning them into facilitators. The other theoretical model that I thought was really interesting that stood out to me when I was reading the paper about Jana Sanskriti was the Transtheoretical Model. If you look on the right here, there are the 5 stages of change that individuals undergo, from pre-contemplation, which is when they're not even thinking about making any change in their behavior, to action and maintenance, when they've changed their behavior and they're sustaining that behavior change. And the reason why this theory came up for me was because some of the processes of change, which is what people undergo as they're moving along the different stages, were just very similar to what to the description of the changes the villagers and the spectators and the actors underwent. So I won't go through all of these processes of change, but I'll just draw your attention, for example, to a cognitive process of change called dramatic relief. Dramatic relief is the anger, the embarrassment, the shame that comes with recognizing one's harmful behavior. And it is a strong catalyst to changing behavior, from contemplation to contemplation. And, you know, watching someone reenact intimate partner violence and realizing that that is something that one does at home with their own partner, their own wife, can just be very powerful. So, and then of course that can lead to a process of self-reevaluation and environmental reevaluation, where the person goes, is this who I really am? Does my behavior align with my values? And there's that whole questioning process. And then on the other side here, the behavioral processes of change, I think a lot of these are processes that the villagers and the communities were using to sustain this positive behavior change. So helping relationships at the top here, or is the social support, having other individuals encourage that positive behavior change. Social liberation, which is the commitment of this new behavior change, and watching that others around you support that behavior. So this is just something that just stood out for me, and I thought it would just be interesting to examine and try to tease out some of the underlying mechanisms of Jana Sanskriti from a behavioral theory standpoint. So some questions or issues to consider moving forward. Would it be of interest? Would it be worth potentially considering a staged matched intervention? We know that certain processes of change are more effective among individuals in specific stages. So certain strategies, interventions are better for individuals that are pre-contemplation, and others are better for those that are already in action and moving towards maintenance. So that could be something that could be worth considering, especially for the video adaptation, potentially putting people into groups depending on their preparedness to change their behavior. And then another question is, how might the intervention become even more effective if behavioral processes of change components, such as helping relationships, are intentionally implemented? And an important question, of course, to not take away from this beautiful methodology that's been developed is, how might some of these constructs or strategies be applied without taking away from the participatory and organic nature of the Jana Sanskriti methodology? And there's also a question that came from my own research, which is how to handle gender differences in terms of psychological antecedents. Men and women have different motivators, and that's something to potentially look at. The other thing that I would like to mention, the other piece I'd like to mention moving forward is how does intimate partner violence intersect with violent discipline? And this is me now putting on my UNICEF Office of Research Chanti hat. I wanted to mention this because of the interest in potentially—
1 minute left.
Okay, thank you. Of potentially looking at violent discipline as a topic. So it's important because IPV and violent discipline often co-occur in the same household. Acceptance of wife beating correlates with acceptance and use of violent discipline. IPV and violent discipline have common roots and risk factors. And children whose mothers experience IPV also suffer negative consequences, regardless of whether they directly experience the violence. So in other words, they're intimately connected. So moving forward from here, additional research questions of interest that I would be interested in learning. Are there positive social normative changes being passed down? Are the children in the households going on to have non-violent relationships or marriages? Is there less violence against children? Are the children in the least violent, non-violent, most gender equitable households also experiencing less violence, i.e. physical punishment or actual violence? And is there a minimum threshold or dose at which intergenerational effects and positive impact on children can be observed? All right, that's it for me. Thank you so much.
Great, thank you so much, Floriza. Very interesting. As we move on to Liz, I just want to remind the audience that you can go ahead and start putting your questions in the question and answer box, and we'll be collecting those, and I will be posing some of those after Liz is done, when we have some conversation among the panel members. Go ahead, Liz, over to you.
Thank you so much. Can everybody hear me? So first, thank you, Susie and Marcella and Cedal, for inviting me to this panel. And thank you, Annette, for the warm introductions and for the fabulous presentations that have come before me. You're all such hard acts to follow. First, just a quick intro to the Sexual Violence Research Initiative, so you know the framework within which I'm giving my comments. We are a global network, and we're working to advance research on violence against women and violence against children in low and middle income countries. And we do this in a number of ways, by funding research and building evidence, strengthening research capacity, promoting partnerships and influencing change. And we really are excited about any piece of research that's going to add another quiver in our toolbox for violence prevention interventions. So the study that Jyotsna and Sanjoy have just shared with us helps us to try and answer the question, can participatory theatre change social norms? And through the evaluation of Jana Sanskriti, or better known as the theatre of the oppressed, as an intervention to address domestic violence, it uses a participatory theatre approach to create supportive spaces for people from diverse backgrounds to come together to experience, understand, analyse and change unjust realities. And so, as I've mentioned, a study on the effectiveness of participatory theatre for social change and violence prevention is such a welcome contribution to the field. As Jyotsna has noted, Jana Sanskriti is a novel cultural intervention that aims to change values and norms that perpetuate the acceptability of violence against women and provide opportunities for communities to develop strategies to intervene in situations. But before I discuss the study and its findings, I first just want to talk about what we as the field are learning of what works to prevent violence against women in low and middle income countries. A research consortium funded by DFID, now at the FCDO, and led by the South African Medical Research Council, called the What Works to Prevent Violence Against Women and Girls program, conducted studies in 15 countries in Asia, Africa, and the Middle East. And this program recently concluded, and the research has really helped strengthen our understanding of violence against women and girls prevention. The program evaluated prevention interventions across the spectrum of different approaches, including community-based approaches that try to shift these harmful gender attitudes, like Jana Sanskriti. And the key findings from this work, and building on multiple other studies, show us that violence against women is preventable within programmatic timeframes, but we still don't know enough about the long-term effects and the sustainability of these effects. We now have a group of interventions that are effective, that can be adapted and taken to scale. And we know that robustly designed and implemented interventions are essential for successful reduction in violence against women. So what have we learned from these programs about design and implementation of these programs from these multi-site, multi-year studies? And how does the Jana Sanskriti program compare with this body of knowledge? First, in terms of design, successful, effective programs that have been found to successfully reduce violence against women and girls perpetration in low and middle income countries generally are well planned, they're rooted in the local context, they're guided by a very clear theory of change, something that Floriza was talking about. They work to tackle multiple drivers of violence against women. For example, gender inequity, poverty, marital conflict, and poor communication. Also issues around mental health problems, including alcohol and drug problems. They are generally based on theories of gender empowerment that view behavior change as a collective and foster gender inequity and positive relationships. And they use group-based participatory learning approaches, emphasizing empowerment, critical reflection, communication, and conflict resolution skills building. They are documented in very user-friendly manuals and materials that support all aspects of the intervention. And really importantly, and I'd like to highlight this, they integrate supports for survivors. For example, during our programming of prevention, when identification of violence is found, where do we refer our survivors to, and what support do we provide survivors with? So in terms of implementation, what does a successful program look like? For community activism and changing norms programs, the more successful interventions largely are based on a mainly volunteer workforce on the ground, and activities are spanned across a very longer term period, for example, around 18 months. And the effective interventions very carefully select or receive nominations from communities for the facilitators that are going to implement the programs, and ensure that they have the desired attitudes that we would like to be seen modeled in the communities before they are even trained or invited to be part of the program. Again, the more successful programs and interventions generally have a longer training for their facilitators, about 2 to 3 weeks, as well as continuous provision of continual support and supervision throughout the implementation, and highlighting in the really importance of deep investment in the staff and the volunteers that are implementing these programs in our communities. From the paper and Jyotsna's and Dr. Ganguly's presentations, we do see that many of these elements that I've mentioned are part of the Jana Sanskriti program. For example, it's rooted in the local context. It addresses some of the key drivers of violence against women and girls. It's participatory and uses critical thinking approaches. It's also activist-led, as Dr. Ganguly spoke about. Yet what is not clear from the presentations or the paper are enough details to say to what extent are all these elements in place. Answers to these questions, I think, are really helpful to us in the field when thinking about adaptation and scale up. For example, is the program manualized? How are the facilitators selective? What does their training involve? How are they supported to address backlash when it arises in their community? It's also not clear in the paper if violence in a family is identified, what support and services are available, and how are referrals made, and how, if at all, are state actors involved in the intervention and the program. For example, the paper talks about strategies of shutting down illegal alcohol sellers. Like, who does that? How is it done? Does it involve the police in these communities, or is it just done by community members? And I'm not saying that this is an issue just with Jana Sanskriti. It's a real common problem with all of our interventions and how we present our interventions in papers. And as a field, we really need to be better at documenting our programs and interventions, detailing how it is implemented, by whom, at what intensity, so others like policymakers or government officials who really want to implement effective programs can better interpret the findings, have enough information to discuss issues of scalability, for example, and adaptation, for example. So does the theatre-based violence against women prevention intervention change attitudes that perpetuate the acceptability of domestic violence among a community? The study, I'm delighted to say, finds that exposure to Jana Sanskriti does play a role in reducing physical and sexual domestic violence victimization. It doesn't measure perpetration, which of course is outlined in what is ethical in terms of our research currently. And it was greatly successful in destroying its legitimacy in the husband's eyes, with some suggestions of sustained change over the longer term. This indeed is a super exciting finding. But as with every program, when considering scale up, there are still some steps needed to ensure that efficacy is at efficacy at scale, and that no harm is done to women. For example, we need more mixed methods research that includes qualitative research to help us identify what are the essential components of a program that must be included in any scale up to ensure that it remains effective at scale. It's important that our programs have clearly documented theory of change so we know what the program is trying to change and how. And we need to standardize our interventions better, outlining the selection processes, the training, the support techniques that are needed, and the processes that implementers need to take communities through a really meaningful and transformative process of change. 1 minute. Safely, our programs are also needed, and our programs also need to develop an M&E framework to evaluate programs as they are being scaled up. We must also ensure that there are services in place for women experiencing violence and that the implementers know how to respond to violence against women and children in families and communities. We need much more longitudinal studies and of course pre-post or RCTs if we have the funding and opportunity to do so. Finally, in terms of the analysis, I'm not able to comment on the econometric models that have been presented, but I just really want to congratulate the research team. It's so exciting to see behavioral economists engaging in this sector, partnering with local programs, and I'd like to encourage so much more of this in our field and more of this in partnership with GBV researchers. So thank you very much for this opportunity to comment on this really interesting program. Thank you. Back to you.
Great, thank you. If I could ask all the panelists and presenters to turn on your video. And the audience may want to turn on gallery view so you can see all of us as we have some discussion. To remind the audience, you can put your questions in the question and answer box, and I will be relaying those as we have time. I wanted to start the discussion by picking up on a couple points that Liz just made and seeing what response Jyotsna and Sanjoy might have to those. So one I thought was very important in terms of trying to understand what the intended recommendations or takeaways are in terms of external validity, as I would say as a geek, or in other words, how much of this is intended to say other people should do this same intervention in other places and we believe that it works, versus just trying to understand how this particular intervention is working in this situation. Because I think, you know, as Liz and many others want to be able to understand from this, what can we take away? What should we be taking away in order to think about how we would design programs? I think related, an important point or question that she asked related to that, understanding what can and should we take away, is understanding a little bit more both about how the program and the research of the program handled adverse events. In other words, when you're implementing the theater of the oppressed, do you have any kind of processes in place to try to understand if there are negative unintended consequences? If people walk away and are angry and behave in more angry ways, or seeking more control than they would have otherwise. And when you were conducting this research, Jyotsna, were you looking for, did you measure, observe, whether quantitative or qualitatively, unintended negative consequences? So maybe if you could start there, and Floriza, if you want to chime in on those questions as well when they're done, that's great.
Should I respond? Okay. In terms of recommendations and how do you scale up? I recognize, I as a researcher recognize that the scaling up on a large scale participatory live theater would be very difficult, because not because of the costs, it's more about the human capital investment that one requires, because we must recognize that the messaging that is going through the narratives, through the acting, if the acting is poor or if the messaging is poor, then it sends out wrong instructions or wrong messages, and which can have adverse effects. So Jana Sanskriti, the quality of the plays are very good and the messages are very clear. But it could be that if you scale up and if the quality of the messaging is not so good, then we might have adverse effects. So that is one disadvantage of live theater being scaled up to, say, even all of West Bengal, let alone all of India. So what are the alternatives that one can try? So one thing which we mentioned briefly in the last paragraph of our paper is try to sort of videotape the plays, the live plays, and do the participatory part as a part of the live play, of the videographing. So stop the video at some point, and then the person who's showing the video, he can become the antagonist and the spectator is the protagonist, and then carry on the conversation there. So in that sense, at least the quality of the messaging is uniform. You don't sort of distort the quality of the messaging. And also in terms of the costs of the human capital cost, that also comes down. Now, of course, it is the second best solution. So we need to actually compare both the live theater as well as the videoing to see whether how worse off are the impacts, or how worse off are the effects of videographing the entire process rather than doing live theater. So that was one thing. And also, like, West Bengal in India is in some senses, the caste problem is not so much entrenched in West Bengal. People who don't know about India, so casteism is less. Maybe the people, because it was ruled by the left government for a very, very long time, even in rural India, they are a bit more enlightened, enlightened in quotes. And so it would be very nice to sort of replicate the entire process in a much more patriarchal society compared to West Bengal, like say Bihar, which is the neighbor of West Bengal, but where the position of the women are much worse off. So in terms of scaling up, one would also like to sort of see whether it works in a much more patriarchal society. Now, in terms of we actually, since I watched the play before starting the research program, and there were no adverse incidents that happened. But maybe Sanjoy could sort of explain or tell us of some of the adverse events that happened and how he tackled them.
Great, Sanjoy.
Yeah, I can't, I have to really explore my memory because I can't see any adverse situation created by this, because my experience is just opposite, because people want space. They want to speak. So the moment you are offering this space, what do you think? Sincerely, I want to listen to you. The moment that approach goes, it connects. So as opposed to any form of alienation or antagonism, the moment you are asking question to the people, what do you think? It connects. So even if they argue, sometimes the interventions are opposite, different, some even supports the antagonists from their perspective. So the session becomes very excited. It becomes very, everybody is involved. Not everybody is saying the same thing, but you see, this is a space. The nature of the space is such that they don't argue to win the game. They argue to understand the truth. They argue to construct the path towards which they will go. So it is all about understanding a problem which they already know, which they live in, because we don't say anything new to our audience because they live in that oppression. So they know, and now their understanding is. So from knowing to understanding is the journey. So this journey is a very, very, very lovely aesthetic journey, because in this journey, people learn. Here, aesthetic acts as an art of learning. So it doesn't happen really, unless you impose your idea on them forcefully. Then it might happen. You shouldn't do this. You should democratize the space.
Okay. So just, I want to make sure we get to some of the other questions that we have. So thank you. I think this is understanding what happens during the theater and after the theater is something that we could keep talking about, I think, for a long time, and is important. But we had a question come in, and I think I'm going to look to you, Floriza, to first address it with your UNICEF hat on, but I'd also really be interested, Liz, in also understanding how you interpret some of the findings around intimate partner violence in other contexts. So the question is, do you think that the forum theater approach could be used with children and adolescents who live in conflict and war zones to help them overcome the trauma that they've experienced? So in other words, this isn't so much about translating this into other IPV contexts, but what can we learn from these mechanisms for other contexts of dealing with violence? So I'll start with you, Floriza, but I would also love to hear from you, Liz, on this.
Yeah, absolutely. I personally think that it really could. And I say that just because I did a midterm and final evaluation of a Promundo project in the DRC. And for those who aren't familiar with Promundo, they work to transform harmful masculinities, essentially, and use gender transformative approaches to reduce all forms of violence. And this specific project in the DRC was intending to reduce youth, to prevent youth from joining gangs. And the DRC, of course, is a context where trauma is very pervasive, and there are myriad issues. And the Promundo interventions, they have several sessions, they have group sessions, and they work on different topics. One is called, for example, The Legacy of My Father, and they explore that. So there are very similar components, I think, that I see with the Theater of the Oppressed. And in their final session, they actually, and the idea is that they change their behaviors. They change their behaviors at home. They change their participation, helping out with the house. They become less violent with their friends, that sort of thing. And at the end, when they've fully changed their behavior, they often have a presentation with the village and with the community, and they do plays, they write poetry, and it's sort of this very public show of how they've become a new person. And it was a qualitative evaluation for the most part, and the transformation that happens and the stories of change are truly remarkable. And it's not something that is incredibly resource intensive. It is similar to the Theater of the Oppressed, where there's a lot of human capital and time and training of the trainers required. But I really do think it could be transferred. And I'll just mention also, it was youth from 10 to 18, I want to say. So children as well.
Great. Great, Liz.
Yeah.
Just from my side, in terms of using the Theatre of the Oppressed as a practice method in sexual assault prevention, there's been some work done in college students, and that's gaining a lot of popularity and is found to be relatively effective, but it's part of a more complex intervention. So it's one part. So it is a part of an intervention that's doing other things as well. And I wonder if Vandana Sharma, I see that Vandana is part of this call, and if Vandana is interested or available to talk about the development of podcasts amongst women living in refugee settings, and how that has been found to, it was a very small sample and a small program, but it did really work to strengthen communication with partners using improve listening skills, and promote more equitable household task sharing and healthy conflict resolution. Those were the reported changes. But the process in developing those podcasts was quite meaningful, in that the people in the communities themselves developed, that were trained and supported and mentored in developing the podcast. So if the Theatre of Oppressed model was to be thinking around different ways of delivering the intervention, it would be really important to see how they could, or we could, do this in a participatory way. But Vandana, are you online still, and would you be able to talk just a little bit?
Yep, here she is, and then I'll come back to you, Sanjoy. I know you wanted to say something on this as well. Vandana, can I give you a minute? Are you there?
Sure. Hi. What would be most helpful to speak about, sort of the approach, the participatory approach?
Sure.
Yeah, I think that'd be great. And it was in refugee settings.
Oh, sure. Yeah, so our project was implemented in a refugee camp in Ethiopia near the Somali border. The project's called Unite for a Better Life. It's an intervention that had been developed for rural Ethiopian communities, an in-person gender transformative intervention involving 16 sessions delivered within the context of the traditional Ethiopian coffee ceremony. For the podcast adaptation, we actually trained refugees within the camp on digital storytelling, interviewing, editing, as well as gender awareness and, some of the content related topics, and then mentored them over the period of a month to co-create the content. So that meant everything from going out and recording interviews, to acting out dramas, to, developing scripts, and then bringing all that together, editing the content together to create these episodes that are fully audio. They run from 20 to 40 minutes, and we, for our pilot testing, broadcast them at listening centers within the camp, where people could come in and either listen individually on mobile devices with headphones, or listen as part of groups in group-based sessions. Now, the model we were thinking about for scale up, if the intervention is effective, is to allow people to actually download the episodes onto their devices and listen whenever they please at their home, for example. And that would also permit them to distribute them and share them peer-to-peer. So the potential for scale up is obviously massive with an intervention like this. So I'll pause there, but thanks for the opportunity to share a bit about this project.
Great. Thank you. So I am afraid we are at time. And unfortunately, because there are a lot of issues here that we could keep discussing, before we start to lose our audience, I want to take a second just to thank Marcella Vigneri and Susie Burdett of CEDL. This is the second event I've worked on with them, and they do a wonderful job of organizing the event. And as I think everyone can see, bringing together a really interesting set of speakers who bring a lot of different perspectives to the questions that we have at hand. I want to let you know that Susie and Marcella are collecting all the questions in the chat and in the Q&A, and we'll be sharing these with the panelists and asking them to respond to them over the next week or so to make sure that we can get these questions answered. There's an interesting question here about, could this be scaled up from kind of civil society to the state, which I think is an interesting question. One that I was curious about was, you know, how much we should be focusing on men and not on the women having to change their behavior, but how much do we need to focus on men in these kinds of interventions? So those maybe are food for thought as we go on with our mornings, afternoons, and evenings. Thank you, Jyotsna, Jalan, for a really interesting paper. I think that your big takeaway finding is edutainment is not enough. And I think that's probably something that we would all agree on in terms of the theory that Floriza presented, in terms of the lessons from many interventions that Liz presented. That finding, I think, is externally valid, and we can agree with that. Thank you, Sanjoy, for sharing so much about the background of this intervention, which is very powerful. Floriza, thank you for the theory, and Liz, thank you so much for really bringing to the table the lessons from a much broader set of studies into which we can put this new round of evidence. So with that, my computer says that we're on the hour. Thank you for those of you who attended today. I believe that the video will be available after the fact, so you can let all your friends and colleagues know that they can attend after the fact, and certainly be in contact with the panelists with any questions that you have. Bye. Thank you again, CEDL.
Thank you, everyone.
Thank you.
Bye.
Thank you.
Thank you so much.
Thank you all.
Thank you.